Parts of northern Ontario have been hit hard by the opioid crisis, with deaths rising during the COVID-19 pandemic. Homelessness and poor access to services have made an already difficult situation worse. Nick Dunn is our Ontario Hub journalist covering the Northeast, and he joins us from Sudbury on what he's hearing from those working on the front lines in Timmins and beyond. Welcome to the show.
Thanks for having me, Jan.
So in 2015, this issue was considered a crisis. Here we are 5 years later and we're still talking about it. Remind us why opioids are so dangerous.
Well, first of all, Jan, opioids are a synthetic opiate. Morphine being a derivative of the poppy plant. You see fentanyl, the most common opioid kind of on the market, is about 50 to 100 times more powerful than morphine, according to the CDC. And other substances like carfentanil are 100 times more potent than fentanyl itself. It can be a highly toxic substance, and you also see it mixed in with other substances. So whether that be your benzodiazepines, your stimulants like cocaine or speed, it gets kind of cut into everything. And overdoses can occur very simply, even if you're not specifically using fentanyl.
Now, I want to talk about your region specifically and Northern Ontario. This is an area, of course, that's bigger than France. And so there are a lot of complex issues. How pervasive is the opioid crisis in Northern Ontario?
Right. Well, to give you kind of a perspective here, in 2019, the rate of deaths, the rate of hospitalizations in both the Sudbury district, Manitoulin district, and the Porcupine Health Unit, which looks at the Cochrane district primarily, these all had more than double the rates of deaths and hospitalizations that were in the province at large. As you mentioned, part of the problem is the sheer size and scope of this region, and that people are dispersed quite far away. It means that EMS is it's harder for them to access individuals who are in need of a call. It is more difficult to access services which are concentrated in cities. You could be hundreds of kilometers away from a city, and you don't have many available services around you.
Now, you've been on the ground researching this issue for a couple months now. Why do you find it so important?
Yes, well, it's the opioid crisis is a crisis in of itself, but it is largely a symptom of other things. It's a cross section of so many different social problems. You're looking at housing, you're looking at mental health services. You're looking at, especially in Northern Ontario, in the Indigenous context here, we're looking at intergenerational trauma. We're looking at sexual abuse. We're looking at systemic racism as a result of, having trouble accessing and navigating these systems that may not be culturally designed for certain communities. While opioids in itself are an issue, it's really a cross section of a multiplicity of these very kind of complex social issues.
Now, as you mentioned, it's a very complex story. And as journalists, sometimes we're restricted in terms of word counts for our stories. I noticed that you put a little bit of your reporting in a Twitter thread, and I actually want to pull up a board, and it reads, "I met Pat at a gathering spot that used to be secluded by bushes. The city cut them down to disperse the people who use drugs there. Folks don't want to use in public, and when these spots disappear, they do it in open or scatter further into the bush, further away from EMS." Tell me a little bit about Pat. What can you tell us about him, and how did you meet him?
Yeah. So I was on an outreach tour with Living Space, which is primarily a housing organization in Timmins, but they do harm reduction services as well. I met Pat at this spot. It used to be kind of bushy and secluded, where people would go to use. Now, the city had primarily cleared it out, the bushes, so that it became more open, kind of dispersing people. Pat was coming back from dinner. He had just picked up his meal at the shelter nearby. And, we just got talking about the situation here. He has substance abuse problems. He's originally from the James Bay. I think he pointed out some of the issues of race that kind of factor out through this whole broader context in Northern Ontario. I mean, you look at the Cochrane district, the Indigenous population comprises about 16% of this population. but the homeless population is somewhere around 50% Indigenous. So, I mean, the numbers there just paint a picture as to, you know, these inequalities that exist in Northern Ontario that are very severe and causing lots of harm to people. But I think, you know, to exemplify this, Pat made a very brilliant observation. There was a lone birch tree that was left amid all these bushes, and he points at that. He says, you know what pisses me off? You know that the only tree they leave up there is the white one.
Hmm.
And it it was you know, he was joking, but at the same time, it was a very kind of prescient, frustrating reality that you know, he pointed out there.
I want to actually bring up some more images that you took while you were on the front lines. This image right here that we're looking at, I believe, are two outreach workers. Tell me kind of what this story or what this photo shows and what you kind of saw when you were out there.
Yeah, so we went out on the streets of Timmins. We were, you know, checking in on people. Well, they were, I wasn't. You know, seeing how they're doing. They were offering, you know, a clean supply of needles, things like condoms, you know, various kind of contraceptions and kind of harm reduction tools, I guess. And they were also picking up needles, kind of scouring kind of common areas to use. You could see there, there was a woman on the right, it said nurse right behind her,
Hmm.
on kind of her backpack there. You know, she is not only a harm reduction manager there at Living Space, but she is a nurse. And many people struggle going to the hospital. They don't feel comfortable there, they don't feel safe.
Hmm.
And she conducts a lot of primary care. You know, people would rather let their wounds fester at times than go to the hospital. And you know, she's basically doing first aid and basic kind of emergency room work on these individuals while on these tours, just kind of talking to people, making sure they're okay, you know, just trying to build a relationship, build some kind of trust, and offer a sense of hope and human dignity that is inherent to everyone.
So, Nick, we actually have another photo here. Tell us what we're looking at.
Right. So this is a bit of a kind of a tin can encampment, if you will. The graffiti there says Hobo Inc. This isn't too far off the road, the main road in Timmins. People are, you know, stuck between living on the streets where there's threat of being robbed, of being sexually assaulted if you're a woman, of being kidnapped. But if you push out further away into the bush, into these camps, I mean, it's pretty dangerous. This is bear country in Timmins, and that is a very real concern that I don't think a lot of people consider. That you know, there are a lot of bears on the outskirts of these towns,
Hmm.
and if you're living in a bush camp, that is a very real possibility. I mean, if it's a possibility while you're camping out around here, just recreationally, I mean, it's just incredibly dangerous, and it's at the back of people's minds, and it limits their ability to sleep.
Nick, I want to thank you so much. Of course, a very important story from your region, northeastern Ontario and northern Ontario. And of course, next week, we're going to actually get into this a lot more as you're co-producing a segment on the opioid crisis in Timmins. So we'll look forward to that. I want to thank you again so much.
Thanks so much, Jan.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.